Morning, ladies and gentlemen. Welcome to the 2014 ACA TOK annual presentation. My name is Sumait, along with my peers Abdulhamed and Osaimi. Today we'll be talking about disease and human behavior, and especially on the topic of how does disease affect human behavior. When we speak about disease, we are specifically referring to the disease of AIDS, which comes from HIV. Okay, what is AIDS? To fully understand AIDS, you have to understand first what is the cause of AIDS. You have to understand what is HIV. So we'll be explaining these momentarily. The immune system defends, the human body's immune system defends the body against illnesses all the time. It uses T cells in the blood called, it uses guard cells in the blood called T cells to recognize and destroy any intruders and destroys them from the body in order to protect the body. But instead of attacking the body itself, the HIV virus, it attacks those T cells and turns them into copy machines to create copies and more copies of itself. Which eventually leads to the killing of all of the most of the T cells by breaking down the lymphoid tissue, which is responsible for creating lymphocytes and also antibodies. So by then, your body won't have an efficient immune system to take on, let's say, the flu virus or the any other disease. It takes 8 years on average, without treatment, for a person with HIV for it to turn into AIDS, and by then there aren't enough T cells in your body to protect you against any other disease, which can lead to it being fatal. HIV was first acquired through blood contact with apes. It got transmitted to more and more people through unprotected sexual intercourse, used syringes, and childbirth, which also includes breastfeeding. AIDS remained undiscovered until an outbreak of homosexual men in New York and San Francisco in 1981. Very quickly, people began developing unusual symptoms around the world, which consist of rare forms of skin cancer, pneumonia, and also thrushes. It became clear that the only way to cure the disease was to prevent it in the first place. The best prevention measure was safe sex, as condoms prevented the disease from the virus from infecting others. Additionally, blood banks are testing blood, and new programs are giving drug users clean syringes. Finally, in 1987, the first treatment against AIDS was released. However, it is unfortunately not a cure. By starting treatment early, people with HIV can live long, healthy lives, but unfortunately without the guarantee, of course, of not developing AIDS in the future. People still in Africa and places of least developed countries, people still lack the access to medication, which is very unfortunate. I'm sorry. Okay, over the past 30 years, 36 million people have died from AIDS, and 2 million more are added, are getting AIDS every single year. Are infected every single year.
Okay, so AIDS is an acronym that stands for Acquired Immunodeficiency Syndrome. We'll break it down now and explain further. Acquired, you do not inherit AIDS. You acquire it after birth. Immuno, your body's immune system and cells and everything that includes organs, systems, everything, fight off that infection. Deficiency, you get AIDS when your immune system is deficient or isn't working the way it should. Syndrome, a syndrome is a group or collection of symptoms and signs that tell you that you have AIDS through HIV.
So why do we choose AIDS? AIDS is one of the most dangerous diseases in our current generation, if not the most. There is no cure for it, sadly, right now. And AIDS is considered as one of the hot topics of the 21st century. Okay, so this is our real life situation. It happened 2 years ago in Kuwait, April 9th. reports Al-Rai Daily, which is a news provider in Kuwait. An Ethiopian maid has given AIDS to a Kuwaiti family. Now this is exactly an extract from the paper, the morning paper. April 9th, a Kuwaiti woman has expressed fear in her grandchildren, aged 6 and 7, who are suffering from AIDS. I've got the deadly ailment from the Ethiopian maid who worked for them 2 years ago by using used syringes, reports Al-Rai Daily. So what are these two kids going to be exposed to right now that they have AIDS? Most likely in our Kuwaiti society, they will be avoided at all costs. Yani if in our Kuwait, maybe this is also in other societies, but especially here in Kuwait, I believe that if you find the person with the AIDS, you will try to get away from him, even though he was a close friend or something like this. Like maintain your space somehow. In extreme cases, the kids might also be they also might be rejected by their own family in extreme cases, and the kids will not get access to proper education, and schools will not take them in due to their illness. It's most probable that they won't get married, because then that would affect the spouse's family reputation. The kids will not be able to work in proper jobs with fixed incomes, of course, because these places require medical reports, which will expose their disease.
Okay, so the emotion part, from the children's perspective. The children will feel embarrassed, they will feel depressed, they will be humiliated, and they will be frustrated. They will be embarrassed because they will be laughed or mocked by their peers. They will be made fun of for something they were not born with, something they didn't choose to have. They didn't inherit AIDS. They got AIDS, and they probably don't even know it. But people know. Depression. They'll feel like life is not worth living anymore because no one wants to talk to them. They don't know what to do with their lives. Humiliation. Now we're basing this on primary research. People who have AIDS tend to make their guardians speak on their behalf because they never have spoken to the outside world. They never have made contact with the outside world. So people never engage with them because they have AIDS. Now they'll be frustrated because they know that they're gonna die. That will lead to depression also. They know that they're gonna die and they can't do anything because there's no cure, unfortunately.
What we mean by they let their guardian speak on their behalf, like if they go to an interview for welfare in the government, they're humiliated, depressed, and also frustrated that they have the AIDS virus. So they tend to let their friend or their family member speak on their behalf. And they have also trouble speaking.
Okay, now emotions from the society's perspective will have two sides: the negative side and the positive side. Now let's start with the negative side. Some people will mock them. Some people will not engage with them. Some people will be disgusted by the fact that they have AIDS. And some people will blame the parents because the maid gave them used syringes. Now, the positive part from society's perspective. People might be sympathetic towards the kids and make donations, get them tested, raise awareness about the cause, visit the patients in hospitals and raise their morals, treat them like normal people. There are people like that. So now we move to ethics. Is it right to treat someone who didn't choose to have that disease like that? Imagine you or your son being treated like an outsider in his own country. Imagine him being treated like someone different by something he didn't choose to have. He got AIDS by the maid being careless. He got AIDS by his parents not caring about him. They didn't even check if the maid has AIDS. He didn't even know what AIDS was when he had the disease. Is it morally ethical to do that to someone, to a kid especially? You will ruin his life. Now, here in Kuwait, as you know, two kids won't feel like normal children. They will not. They will feel different. They will be in a bubble, alone. These two kids. The kids will feel like they're not human because other humans won't interact with them. Even though if you talk to them, you can only get AIDS from these two kids by, as he said, use syringes and many other ways. But people still avoid him. And in extreme cases, if you talk to him face to face and he coughs or he sneezes, that happens in really extreme cases. So people still don't talk to them. People still zone out from them. Even though there is a minimum. Okay.
The best way, I think, to give an example is Magic Johnson, one of the best point guards to ever feature in the NBA. When he first got HIV, not AIDS, he's still living with HIV. When he first got HIV, there were like myths and like sayings, like if you shake hands with a person with HIV, you'll get it. If he sneezes in your face, you're gonna get it. If he coughs in your face, all of these other stuff. If you sit on the same toilet seat, you'll get it. So it reached to the extent where his own teammates didn't want to play with him. They're like, don't put us on the team sheet if he's gonna feature in our starting five. So yeah. Religion. We move on to religion. The official religion of Kuwait is Islam. The Quran teaches, one of the teachings of the Quran was that everyone is created by Allah, which is God, and that all are equal. However, not all of us, not all Muslims are perfect, and not all of them will follow the teachings of the Quran. There will be people that will not follow them, and also other faiths are guilty of prejudice and discrimination of the AIDS, of this with AIDS.
Now, we'll give you a verse from the Quran that talks about discrimination. First, I'll read it in Arabic, and then I'll read the translation in English. قال الله تعالى: يا أيها الذين آمنوا لا يسخر قوم من قوم عسى أن يكونوا خيرا منهم ولا نساء من نساء عسى أن يكن خيرا منهن ولا تلمزوا أنفسكم ولا تنابزوا بالألقاب بئس الاسم الفسوق بعد الإيمان ومن لم يتب فأولئك هم الظالمون. In English, O you who have believed, let not a people ridicule another people. Perhaps they may be better than them. Or nor let women ridicule other women. Perhaps they may be better than them. And do not insult one another, and do not call each other by offensive nicknames. Wretched is the name of disobedience after one's faith, and whoever does not repent, then it is those who are the wrongdoers. Now we'll read another verse from the Quran talking about discrimination, and then I'm going to translate it in English. قال الله تعالى: يا أيها الناس إنا خلقناكم من ذكر وأنثى وجعلناكم شعوبا وقبائل لتعارفوا إن أكرمكم منكم عند الله أتقاكم إن الله عليم خبير صدق الله العظيم. Now the English translation: O mankind, indeed we have created you from male and female, and made you people and tribe that you may know one another. Indeed, the most noble of you in the sight of Allah is the most righteous of you. Indeed, Allah is knowing and acquainted. Now notice, in the first verse that we read, he said, "Oh, you who have believed." He was talking just to Muslims. He was telling the Muslims, "Ya ayyuhalladhina amanu," which means, "Oh, you have believed." But in the second verse, he was talking to mankind. He wasn't talking to people who wasn't talking to just Muslims. He was talking to everyone. So in the second verse, he's telling everyone, God in his book, holy book, in the Quran, he was telling everyone, mankind, do not discriminate. Yet, as my friend said, the official religion of Kuwait is Islam, and the majority of people in Kuwait are Muslim. Islam teaches us not to discriminate, not to ridicule, not to give bad nicknames to people. However, you still see Muslims discriminate, and this is the main cause for this cause. Or this is the main reason for this cause. Now, how is this linked to TOK? How is this linked? Because Islam teaches us not to discriminate, and this goes by ethics in TOK. Now, first of all, in the two verses, they almost said the same thing, but in different meanings. But they had the same goal: do not discriminate. Both verses. But the first verse, he was talking to Muslims in general, us Muslims. And then in the second verse, he was talking to everyone. Do not discriminate. So that teaches us how important Islam is against discrimination, how big discrimination, how heavy you will be, how hard you will suffer in hell from discrimination. That is how God sees discrimination. Yet we still see people discriminate other people. He didn't get this disease. He didn't choose to have this disease, but we still discriminate. This is.
Basically, here in this room, we all know that people in Africa are dying. People in Africa are dying because of several factors. These factors are affected by intuition and reasoning. I'm going to use intuition, which is a way of knowing into your case. It's basically the ability to understand something instinctively. If some people they don't understand something instinctively, so I provide reasoning, so their instincts would be driven by the reasoning, and so they could be able to see the situation in Africa, in Ethiopia in this case. How? Why? Why is it this way? Why is this Ethiopian made? Why did she get affected by it? What's the reason? So basically, it's linked to reason. The reason is economics. In economics, there is a topic called development economics, and this topic is basically talk about the development of a country. Development basically means there's two types of development. There is a developing country and there's a developed country. A developing country that I'm going to focus about here is Ethiopia. It's a poor agricultural country that is seeking to become advanced technologically and economically and socially. So Ethiopia, in this case, they're seeking to be developed due to several factors, such as healthcare. They want to be developed in healthcare. But first off, like developing countries are characterized by major factors that lead to their development. These are healthcare. In developing countries, you often see low healthcare, low incomes, low equality. There is even very low education, and because they're uneducated, this leads to a very high. The population is uneducated, so they often give birth at a very high rate, which leads to a very large population. Next, please. We can see here these are like the houses. We can see the unclean water, which is one of the characteristics of a developing country. There is no clean water. We can see that this kid is drinking water from very dirty water from the river. We can see that those people are starving. We can see at their bodies they don't have enough nutrition due to starvation. Even here we can see they're hard working and they're not getting enough income, enough on education. You can't spend enough in education due to your low income, and you can't spend on low healthcare either. So you're stuck. So you have sick people, and they have low human capital, meaning they don't have the skills, they don't have the education due to the low spending. They can't spend on education. They won't have good skills to work. They won't have, and thus leading to lower productivity because they're already sick. They're infected by AIDS. If most of the population is sick, you can't be productive enough to work, and that will lead to a low income. Economic growth, we're not considering economic growth in this presentation, only we're looking at economic development. Okay, my analysis is being provided by Kofi Atta-Annan, is a Iranian diplomat who served in the United Nations. He said, the fight against HIV requires leadership from all parts of the government. To go right to the top, AIDS is far more than a health crisis, it's a threat to development. Links between intuition and ethics. How important is intuition and in ethical decision making? If your intuition, some people, their intuition, which is the ability to understand something instinctively, is not always working. So I provided an economic analysis to drive those intuitions to make them understand why should we care, what should we do. In this case, we should help the society. I provided the reasons why, because they have low health care, they're being infected, people are dying there and starving. So we should educate those people. We should tell them to decrease their population size so people won't die due to the infection. We should donate. We should provide better health care. We should raise awareness so those people can be educated enough and decrease the infection in Europe.
Yeah, thank you so much.
Thank you.
Any questions? Okay, thank you.
Thank you very much.